Don't stress. It's a phrase that's easier said than done. But a new study finds people who have high levels of stress face an increased risk for stroke. Researchers in Spain compared stroke patients to a random group of healthy adults. They found those who experienced chronic stress for 6 months or more were significantly more likely to have a stroke. People with type A personalities, meaning those who are impatient and have quick tempers, also had an increased risk for stroke. Now, we all experience stressful moments when we feel anxious, overwhelmed, angry, and even scared. But many adults, even children and teens, suffer from full-blown panic attacks. So, what are the symptoms and how do we handle a panic disorder? Joining me now with the answers is Dr. Bradley Wajda with Esano Incorporated. Good morning to you. Good to see you again, Dr. Wajda. First of all, I got to ask for those people that are not familiar, what exactly are panic attacks?
Well, panic attacks, that's a cluster of symptoms that oftentimes people believe are heart attacks, or they fear they're losing their mind. They even take it as impending death. But it's an intense fear, usually with a racing heart rate called palpitations. You can actually feel your heart beating in your chest. Shortness of breath, break out in a sweat, get tense and shaky.
And we'll get back to the symptoms in just a little bit, so that way we can give people more of a better understanding. But what brings them on? What causes panic attacks?
Well, there are many different potential causes. It can be a call from the IRS. It can be, it can actually be side effects of medication. It can be people who abuse substances. Certainly methamphetamine is used a lot in the valley, and a substance like that can trigger a panic attack. Thyroid disease, phobias, obsessive compulsive disorder, a variety of things.
So are they common?
Very much. 20% of the population will experience one or two in their lifetime.
How do we know when they're becoming a huge problem that we may need to see somebody for this disorder?
When they're recurrent, when you're experiencing them. Like I said, 20% of the people will experience one or two, but people who have panic as a disorder or as a symptom of another disorder, those are more frequent.
How about kids and teenagers? They're under a lot of stress, not the stress that we're used to, but...
True, and it does occur in children. Less than 0.7% of kids will have panic disorder or a generalized anxiety. As a matter of fact, for people who have panic disorder, which is an illness which is strictly a series of panic attacks, that first panic attack occurs usually between age 15 and 19.
Okay. So as parents, what should we watch out for? So let's get back to those symptoms again.
Well, if you're a parent, and you're always going to see this not as a panic attack, because it does look like a medical emergency. I mean, people have a fear of dying. They're short of breath. You know, they're trembling. They feel smothered or choked. You know, they usually are nauseated. They can have chest pain, numbness, and tingling. Many emergency room visits for what is thought to be a heart attack do oftentimes turn out to be panic attacks.
Wow, hot flashes, chills, nausea, abdominal distress, so many things that, will you necessarily be feeling all of this at once?
No, the definition of a panic attack is just 4 of those. And panic attacks generally are brief. They peak at about 10 minutes. So they're short duration.
Now, what if someone we know, or someone next to us, or a family member suffers from one of these, and you know and they tell you, I've had a friend say, I'm suffering from a panic attack. What do I do?
Well,
what do we do?
At that point, it depends on whether they've learned breathing exercises. There are different therapy techniques to help them try to gain control of a panic attack. If they have been diagnosed with a panic attack, they most likely will have a medication with them to take. I do want to emphasize that if somebody begins having symptoms like a panic attack, but they don't know that it's a panic attack, they haven't been diagnosed, certainly don't treat it as a panic attack. I would always treat it as the worst case scenario until you're told by a physician that it's not cardiac.
So you mentioned medication. There is treatment that way, but what other types of treatment can someone who suffers really from an overwhelming amount of stress that can lead to panic disorders or panic attacks, what is a treatment for that?
Well, you mentioned something about stress. Stress management, that's a big one. Some people believe that they can just manage stress forever, that they don't have to do anything to try to take care of themselves. But relaxation techniques, stress management, plenty of exercise.
When you say stress management, is that a class or something? You go to a class or you talk to someone like yourself? Okay.
You can go to support groups, but stress management too can be just recognizing what your limitations are, realizing that you need to limit the stresses that you take responsibility for.
Okay.
Again, good sleep, good exercise, avoiding things like caffeine. You know, we talked about energy drinks a while back. Avoiding drugs, alcohol. Those are things that can help. Now, certainly psychotherapy, getting into counseling, that can teach techniques as well to help you manage, recognize situations you should not go into that may trigger panic attacks for you, and help you manage them once they start.
So there certainly are options.
True.
Certainly are options. So contact Dr. Wajda if you have any questions or want to maybe schedule an appointment with him. The number's right there on your screen, 999-9514. And you have 2 offices on Herndon Avenue here in Fresno and then one up north.
That's true.
In Merced. And that number is right there, 384-0800. He can certainly help you with your stress management. Thank you so much, Dr. Wajda, for being here, and we will see you next week.
Okay.
All right, stay tuned. More Central Valley Today.